Okay, thank you for this kind of introduction. My presentation will be focused on this ongoing project that is also focused on the study of techniques and 3D printing processes and release of materials during these kind of processes. My talk will be start from a general introduction state of the art on technology and PEROSH questions. Then I will move to the methodological approach, and then in the last part of my presentation I will report some preliminary results of our case study of this ongoing project. So, as also yesterday we discussed in the other session, and as probably you know, we are at present at about 20 years after the first studies and the first guidances on responsible development of engineered nanomaterials and nanotechnologies. As probably you know, the first guidances was produced in UK from Royal Society of Engineering, highlighting for the first time the risk and opportunities of nanotechnology in the workplaces. After that, we had a lot of publications, and you can see a very, very impressive trend in the last 20 years relating to nanotechnology, in the less amount nanotechnology at work and exposure issues. In the last year, and you can see in the yellow line, we had a lot of publication in our field related to the prevention to design approach. The design approach that was introduced by NIOSH in US, and then it was also agreed by PEROSH in a document. In this approach, we apply all the prevention strategies, starting from the design of the materials and the technologies in the processes. So it is a part of the whole safe sustainability by design approach. But in any case, it was applied in some studies very, very successfully in the last year. So after that kind of work and publication, we was pleased to participate to the drafting of WHO guidances on nanomaterial work health. It was based on systematic review of literature. So WHO in 2017 gives some recommendation to study, manage, and use in a safe manner nanomaterials in the workplace. After that, we had some regulation important milestone, because in 2018 the REACH included nanoforms in the annexes, and the last one was the first time that we had nanomaterials cited in a EU directive, because the EU directive on protective personal equipment use reported that it is mandatory for some work processes to use protective equipment when workers use nanomaterials in their activities. So, based on this overview, we are able to have a look on the state of the art of this matter. We are aware that it is based on all knowledge on the burden of diseases related to the ultrafine exposure and pollutants, no? That we could have potential risk and adverse health effect when we are exposed to nanoforms and nano-objects. The key points are related to the nanoscale, dimension, the shape factor of the materials, and also the aerodynamic properties, because some, for example, bidimensional material could have, I don't know if you are familiar with graphene or similar materials, they could have some unusual aerodynamic properties, so they couldn't respect the size ranges of the devices and the instrument when we sample this kind of materials. Still, now we have a lack on the comprehensive studies that include also water biomonitoring. There is a difficult to have a study that have both a comprehensive exposure scenario characterization and biomonitoring of workers, and then we do not have any occupational exposure limit defined by law. So I would like to highlight that in that case it is important not only the contribution in terms of mass, but also it is important to refer also to the concentration value in terms of number of particles, because at the nanoscale we have an important amount of particles that correspond to a low mass contribution. Okay, just to define our field of interest, and this is probably the answer that I gave yesterday to our colleague that asked, because nanomaterials probably are not now among the priority for the next section in the future, because probably we have a lot of knowledge now, so we have defined this problem. Probably researchers are more familiar with this matter, and then probably we are moving to include nanomaterials in the whole definition of advanced materials. So the problem is moving to identify the properties that allow to the materials to have different behavior compared to the bulk material, and also to have to produce structures that have an improved property. So all these materials are used in the clean technologies that are defined by Horizon Europe program, and among these technologies we have the additive manufacturing. Additive manufacturing is defined by the ISO guidances. It is a process to join materials of different type of materials, starting from a software model that is designed in 3D, and then it was moved to the machine that manufactured the product layer by layer. 3D printing is a part of this kind of technologies. In some cases, the terms are used as synonymous, and we have a lot of additive manufacturing technologies. In that case, we will focus on the material extrusion by fused deposition modeling and on the stereolithography, that are probably the most commonly used technology until now. Okay, just to have a look about the materials, because I mentioned that not only polymetric materials can be used in this kind of process, but also metallic, ceramic, and carbon-based. About the KPI that we need to take into account when we face this kind of studies, we need to consider the health risk, the exposure pathway. We know that inhalation is the major pathway for exposure, but also it is important to consider that in this kind of process we could have also the emission of other substances, other dangerous substances. So the challenge is to are able to separate the effects and recognize the effect of particles compared to the other substances. Going to the methodology, we applied the ISO SEN methodology based on the OECD guidances related to the tied approach to characterize the exposure scenario in which we use nanomaterials. This kind of approach is based on three different tiers. The first one is related to the information gathering about materials, substances, and also about the processes. The second step is related to the basic exposure assessment by using handling instruments and some samples, for example, condensation particle counters, diffusion charger, and similar handling instruments, and then also samples on airborne particles in the workplace. The last part of the study will be focused next year on the comprehensive exposure assessment by using also other metrics in order to characterize all the parameters that could be important for the exposure. And then we was pleased to integrate in the study the collaboration with the STAMI, that is the Norwegian Institute for Occupational Health, that supported us in the toxicological analysis related to the materials used in these processes. Okay, moving to the case studies. The first one is a typical 3D printing process based on fused deposition modeling. The material is extruded by this machine. This is a box of 1 meter per 1 meter, and inside we have a nozzle. The filament, in this case polyamide and thermoplastic polymer acrylonitrile butadiene styrene, was tested separately, and then temperature allow to deposit on the platform. This platform is moving on the upper side of the machine, and then this kind of object was fabricated. So the technique is very flexible. We can custom the object that we need. In that case, the experimental setup it was based on the production of this kind of object. There are some typical plastic objects that we use in some products. And then we can note that the average length of the project is 17 minutes. It is an open printing system because on the upper side we do not have any containment. And the operator should manually start, monitor, and finish this kind of process. So we have a lot of interaction with the machine. We have some differences between the two materials that we tested, because about polyamide, that is simply known as nylon, this nylon filament. Our colleagues from STAMI Institute conducted some exposure in vitro study by using the materials in amber blue assay and LDH assay. They did not highlight any increase in cell membrane damages, so they suppose that they not have a lot of toxicological issues related to this kind of materials when we analyze the pristine material. So in the next part of the study, we will try to analyze the filter that we collected in the workplace exposure scenario. But about the emissions, it is important to highlight that in correspondence of each printing session, we note an increase in particle number concentration in the submicrometric scale. The condensation particle counter is the instrument that we use here to measure the particles. Has a size range between 10 to 10 nanometers to 1 micron. Okay, so we have an amount of particles that are in the nanometric size range. This is the size range that we measured inside the room in each printing process, and in this picture it is the size distribution in the nanometric range, because it's range from 5 to 500 nanometers, the graph, and it is the size distribution, the average size distribution of the peak, the printing emission peak. So this result cannot confirmed by our SEM analysis, because we analyzed on the sampled materials the materials collected on the filters, and we noted that the structure, like polyamide, are very large compared to the nano size range, because there are probably in the size range of some microns, and probably we should further investigate this kind of emission in the nanometric size range, because probably we have other pollutant produced by the process that could be contribute to the previous amount of particles. The second materials, probably you know that ABS is a very toxic material. In literature we had some evidences about the hazard related to the use of this project, and it is classified as carcinogen by the ERC. You can note that in that case, compared to the previous one, we have a very large amount of particles emitted during the printing process. We should note that it is the same experimental setup of the previous case. In that case, we have an amount that is 3 or 4 times higher than the previous material. So probably the ABS is more volatile of the polyamide. And also we should note that the peak continues also after the finishing of the printing process. So probably it is the moment in which the operator goes to the machine in order to remove the products, and then in this moment we have already a lot of particles that are present in the room. So it is an important information, because we could also arrange some working procedure in order to have a delay between one process to the next one, in order to avoid this kind of exposure for the worker. Also in that case, we have a size distribution in the nanometric size range. In particular, it is confirmed by literature that ABS typical size ranging from in the range from 10 to 18 nanometers. 80 nanometers, sorry. I reported also the results of this other case study, that is another kind of technology, more recent, that is stereolithography two-photon polymerization. It is a very updated technology. In that case, the machine is contained, is closed. The process happens in a closed system, and the materials that we use are photoresins in very small quantities, because this kind of nanoscribe printer is designed to produce very small structure in the micrometric size range. They are used typically to produce some sensors and miniaturized structures. In that case, the process length is from 3 to 24 hours. The system is closed, and we have the possibility to manage the process from remote. So we have less contact with the machine. The operator, you can see in this little picture, charge the resins in a vat, that is the polymerization vat inside the machine, and then the operator moved to the office and start from remote the process. In that case, we have all the particle number concentration that are lower than the significant value that is calculated as the value consider the limit beyond we probably have an emission. We have some hot spots, but probably they are due to some wrong measurement by the instruments. We don't highlight any structure like a peak of emission as in the previous case, and also Otherwise, we know that in any case, the exposure to photorays could be, in some cases, toxic for workers. So, just to summarize and conclude this presentation, we started our project in order to try to analyze this kind of very new and more common kind of process, because we have a lot of 3D printing in our institutes, I think, and also we have a lot of this kind of objects also in schools, in high schools, and probably we need to improve the information about the potential risk of emission of these kind of technologies. We note that there are differences among different technologies that we use, and the materials. The materials that we use are important because in some cases they could be very harmful, and also they could be more volatile compared to the other one. Finally, the last case study highlighted that the updating of technology allow us to produce some machines that are contained, which have local exhaust ventilation, for example, and probably it is important to regulate the working procedures in order to avoid the exposure factor, that is the interaction between the worker, the machine, and the emission in the room. So we will continue our study in the next year, and we hope to have a comprehensive outlook of these results when we will analyze all the data. Thank you very much for your attention, and we'd like also thank the colleagues that collaborate with this study. Thank you very much.